I'm Dr. Amanda Childress, and I'm a doctor of pharmacy, and I am advanced clinically trained in nutrition response testing.
I'm going to ask you my favorite question is, how did you get into nutrition? Like, what was the thought process like that changed in your mind to get you to get into this kind of nutrition where the way that we're practicing now?
Wow, that was a pretty big and long evolution, so it's a little hard to summarize it because I really had no design at all on doing anything with nutrition or anything with holistic health. But I was working as a pharmacist, and I had all these really big ideas about how I was going to help people, and I was fascinated by how the body works and biochemistry and pharmacology. But then when I actually started practicing as the pharmacist, it didn't really happen that way in real life. It was a lot of medications to manage symptoms and a lot of other problems related to that. So I spent a lot of my career putting out fires. So that wasn't what I wanted to do. So I actually just up and quit my job after getting my PharmD and just looking for what's next. What can I do that I feel like helps people in a more meaningful way? And that's how I ended up finding the Nutritional Healing Center. When I first started working at the office, I was basically just trying it out because it sounded a little bit, honestly, hard for me to wrap my brain around as someone, who's very research based and working in conventional health. But I was open and I'm like, okay, I'm going to get a job working there, but I don't know about this. But I'm going to see what it's like up front. So I was assisting and, doing a lot of various jobs around the office, and I was in client visits helping. And there was one day that I was in a room with Dr. Schmidt, and he had a client, and she was an old lady that was probably over the age of 80, and she had rheumatoid arthritis, and her knuckle was this big. It was huge. And in this visit, she said, yeah, I cut out sugar and my joints don't hurt anymore. My arthritis pain is totally gone. And I'm standing there like, that's not supposed to happen. Like, the best we can do with medication is slow disease progression. I've never even heard that that can happen. But she was so exhilarated, and she was so, I mean, I believed every word she said. She was so happy and she didn't appear in any pain. And I was like, wow, this is real. And, that's when I really decided I'm going to pursue this route fully.
Nice. So you've been practicing this way for how many years?
15.
What kind of patients do you like to work with?
I'm a systems thinker, so I really love working with people who view this is a partnership where they're doing a lot of the work themselves, but I'm here to help them recognize patterns and empower them to be able to be their own health advocate and drive themselves when it comes to their health. So people who are willing to look at it that way and then help me find those patterns by tracking, changes. What's better, what's worse, what's new, and making those connections together. So that requires a lot of logging and a lot of thought, but also, applying it in a bit of a formulaic way. So I really enjoy it when we're able to bring all that data together and paint like a full picture of all these connections.
That's nice. So I know in the past I've given you a lot of patients who are on a lot of medications because you're a PharmD, so you can have some direction and guidance and maybe even get some people off medications with your authority, right? So, so looking back on all that, has that been rewarding for you, or has that been a big pain in the butt?
Both. The truth is both. Because, the truth of the matter is when people are on a lot of medications, it makes things more complicated. And it a lot of times those people are also the more strongly medically minded people. So they can be more challenging to work with at times. But it's also been extremely rewarding. I've gotten hundreds of people off of medication over the years, including some very hard to get off of medications. And I've helped people get unstuck on some of their medication weaning before. So I'm uniquely positioned to be able to help people do that. So it feels really good to do what I like to call reverse pharmacy, where I'm helping people get off of medication. And, it's also exciting because, when I started doing this 15 years ago, it really wasn't happening. No one was really doing it. And now there are definitely more people on board, but there's actually very little research that describe how to get off of the majority of medications, especially the psychiatric meds. So it makes it very difficult for both clinicians and patients to do. So I do feel very good knowing I have this unique skill, and I'm uniquely situated to help people do that.
It's very interesting. You heard me talk about how my TikTok channel got banned 2 weeks ago.
Mm-hmm.
And I'm thinking about like what was happening at the time. So for the last 6 months or up to a year, I've been engaging with a lot of medical doctors on social media, on TikTok. And they have this, philosophy of, okay, we have to get a differential diagnosis to come up with one single diagnosis. And then we supply a drug for that diagnosis. And you have another specialist who does the same thing. Now you're on 2 drugs. You go to a third specialist. Now you're on 3, 4, 5 drugs. So polypharmacy. So I started calling out like, okay, the more drugs you take, the greater your chance of mortality, and being sick. So I think that was like maybe one of the most offensive things that anybody could say to a group of MDs on TikTok, and maybe maybe they're reporting me a lot, and that's why I finally got banned on TikTok. But
It's possible that it's just objective fact.
yeah, and it's like I feel like I'm the only one talking about polypharmacy is not a good thing to do. Now the opposite of that is healing your body, and it takes diet and supplements to do that, right? So you have both. You have the ability to take both sides, right? You can handle the medications and adjust as needed, and then supply the nutrients and the change of diet so the body actually heals. So that's pretty unique. It's really cool.
Thank you. I like to think so. There's a lot of people out there because, one of the things that I like to foster with my practice is that this isn't just a survival of the fittest thing. Because there's some people who they're at a health state right now that they can't fully get off of medication. Maybe, they have dangerous blood pressure that just taking herbs and eating well isn't going to immediately correct, or some other life threatening condition. And the point is not that they're broken and they can't be helped. There's a way to be integrative to get them the best possible outcomes. So sometimes you do have to do a little column A and column B. The problem is our two groups don't really like to work together. So I'm kind of in a little bit of a middle ground, and sometimes I'm able to talk to, doctors or pharmacies or other, be like a bit of a liaison when they're not willing to listen to more purely holistic individuals. Right or wrong, that's just the way it is right now. We're not really doing a group or a team effort, which would be the ideal scene, in my opinion.
Yeah. Throughout my career, as I've gotten people better, they go back to their medical doctor and say, I've been doing these healthy things. I'm doing better. So maybe I need less drugs, lower dose,
Mm-hmm.
or whatever. And for 25 plus years, the doctors have always said, don't tell me what you're doing, keep doing it. And then they would change this medications. But now on social media, there are doctors outright, flat out, just saying, don't take supplements. It's kind of wild. So
Mm-hmm.
there's got to be there's got to be some working with the two groups of people. So I've been speaking, on this blood test MVX Plus, and this past weekend I was speaking to 180 dentists, and I've spoken to 80 doctors back in August, medical doctors, and then of course chiropractors, naturopaths. So it might be that this one blood test MVX Plus can unite all the professions, and like the whole goal is to like make this overall score better. You have any thoughts on that?
I mean, I think that would be an amazing thing to see, and it should be something that we can all kind of agree on because, the research that's been behind it has shown that these markers are the most connected to mortality. And, as you've mentioned before, the measures that we use right now aren't working. You can't tell really someone's health just by blood pressure or weight or cholesterol alone. We see that time and time again when you actually do the labs on clients at various states of health. So if we could all work together, that would be best for everyone. That's where patients are going to have the best outcomes, are going to get the most healthy. Because, when it's coming to public health, the idea shouldn't be we're warring against each other and it's all or nothing. We need to be able to meet people where they are. And my viewpoint is that the goal is helping someone be more functional and healthy and able to do the things they want to do. It's not just, well, it's natural, so we're going to do that just because it's natural. It's about getting actual results.
Right. And I think you had a patient who had a high score on MVX, which is not good. And then he went on a Humira style drug, for arthritis or something, and we're considering that it dropped his score to a healthier range, right?
Yeah, there were multiple things that happened for him. We had been trying it just purely naturally for a long time after his RA started, and it just wasn't going anywhere fast. And he was still getting progressively worse. So in his case, he needed to do something. But before he got to me, he was on prednisone. And I think the prednisone actually did a lot more harm than good, even though it was hard to get off of. So during that time, he got off of the prednisone, went on to a new biologic drug, and was also, we were changing up his plan to try to accommodate healing as well. So yeah, he had a huge jump, but medications were definitely part of it. Both going off and changing to a new one were all part of the whole picture.
And did obviously he felt better, pain reduction,
Yeah.
right?
So before, every day was a bad day. He still has, bad days, and he's not perfect to where he wants to be, but he has more good days than bad days now, which is huge considering the trend he was on. But I was actually, when I saw his MVX score, and this is an area where MVX I see really shine, in that people, when that score is really high, those are always the really sick people. Like, it really measures that really well. So that was really consistent with where he was going with his health and how it was progressing. So to see that score go down and also see him feeling better was really validating to the score, but also reassuring for me about the direction his health was taking.
Yeah, nice. Yeah, so similar conditions can have such different outcomes when you're approaching it naturally. So I've had good successes with a variety of arthritis conditions, and then on the same token, not, you know. So
Yeah.
there is a role for medications but I always think like the natural route would be the least expensive, the most conservative, the least side effects, but then the medications could come in later when all else fails. That's how I see it.
Yeah, I 100% agree. And, for some clients, they're doing their healthy things and detoxing and seeing results, but then at some point they're like, oh, I'm doing great, and they might get a little complacent. And then when they kind of fall off, that can sometimes be where these conditions come in as well. But it's much harder to get it under control once that has happened and once that disease process has started than before. So again, it's what we've been saying forever. Prevention is where it's at and where most of our efforts should be where possible.
Yeah.
And that's part of why I love working with children.
Oh yeah. Plus they heal so fast.
They heal so fast, and then you can prevent them a world of issues down the road if you give them the right toolkit immediately.